You know that guy disinfects his computer keyboard every day. He is so OCD. Why is this term OCD, obsessive compulsive disorder, so embedded in our everyday speech? Why does this dysfunction turn up so much in our movies and TV shows? Is it because so many people can relate to these traits? But where lies the dividing line between someone who's a bit over-preoccupied with cleanliness or order or routine and someone who might be diagnosed OCD? Legendary aviator Howard Hughes' painstaking attention to detail distinguished his films and engineering before he sunk into deep debilitation. Can OCD traits give people a competitive edge on certain fronts? Joining us to probe these and other matters of OCD today is Dr. Jessica Russo. She's a clinical psychologist with decades of experience helping people manage and resolve addiction, anxiety, depression, and other mental health issues. Today, she illuminates the brain mechanics of OCD and through real-world examples illuminates underlying causes of this condition and how she's guided people in their recovery. Welcome to Vital Signs, where we learn how to get healthy from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendan Fallon. Dr. Russo, wonderful to have you join us on Vital Signs again, and fantastic to get your perspective on this topic, OCD, obsessive compulsive disorder, that has really pervaded our mainstream, our pop culture, from TV shows to cinema, and has become part of our everyday language. We throw this term around if someone's a little bit meticulous, if they like to be particularly ordered, or they've got a thing for hygiene or cleanliness, we tend to call them OCD. But I wonder, where does the line lie between someone's quirky behavior and someone who has a full-blown anxiety disorder?
Yeah, it's a great question. And it's true. So many people are talking about themselves this way. There's two major distinctions here. One is that these obsessions are really distressing for the person. And that's often not true with people who just have obsessive thoughts. And the other thing is these obsessions are often accompanied by compulsions. And we can see in the brain that there's a real difference between somebody who has OCD and somebody who doesn't. So there are four major regions of the brain that are overactive in OCD. So you have the orbital frontal cortex, which is one, and this is in charge of decision-making and risk assessment. So if you are needing to use the bathroom and there's only a public bathroom, you're going to assess that as very dangerous, where someone else might think, okay, this is just a low level of risk. There's contamination, but that's fine. I'll just wash my hands. I won't touch anything. No problem. That may not be the case for somebody with an OCD brain because of this overactivation. And then there's the anterior cingulate cortex, which works alongside this other section. That first region I mentioned, that's right behind the eyes. This is one that's just a little bit deeper in the brain, and this is involved in error detection and emotional regulation. So something being wrong in the environment, or you've done something wrong. That's very common with OCD. There's a real focus on making a mistake. I've made a mistake. It's a horrible mistake, catastrophizing. And that can really be unbearable. And, this is where the compulsions come in.
This could be like a moral mistake, or it could just be like a messing up in a test or something like that. It's not specific to any particular kind of error.
Not normally, but there definitely is a theme of not wanting to hurt other people and fearing that you are. So it often shows up that way. So the idea being, I've done something to really hurt someone. I've disappointed someone. I've compromised someone. There's a lot of shame that we see in OCD. So you've got that. And then you've got an area called the basal ganglia. That's deeper within the brain. And that focuses on habit formation, movement regulation, and again, very overactive. So this is where the repetition comes in. People with OCD, they may engage in a compulsion, but they can't necessarily stop that easily because this signal to stop is just not activating. They think, okay, I haven't done enough. I have to keep doing it. Maybe they don't even know why they have to keep doing it, but they're compelled to keep doing it. And then finally, there's the thalamus. The basal ganglia surrounds the thalamus, and the thalamus is in charge of receiving information, relaying information, and again, very overactive. So you have this circuit that normally in a normal brain, you recognize, okay, I need to do a task. You do the task like washing your hands after using the bathroom, and then you're done and you can leave the bathroom. But somebody who doesn't have that stop signal, they're not going to be able to stop. They're just compelled to keep doing it. So that's a really big difference between somebody who just has some obsessions and someone who has OCD.
You mentioned that washing the hands. I mean, this is very common compulsive behavior associated with OCD. What are other common behaviors, common tendencies that you see coming through or that you're aware of?
Mm-hmm. Checking is a big one. I think everybody knows this sort of the quintessential checking to make sure you turn the stove off. And again, somebody who's going to just be a little bit more obsessive and worries a little bit more than the average person, they might be thinking, oh, did I turn the stove off? Maybe they might even go back home if they're not too far away from home just to check. But usually that's pretty much it. They get in their car and that's the end of it. People who have OCD are not satisfied with having checked once or twice. Maybe they end up getting in their car and driving away, but they have to come back no matter how far it is because you've got these activated signals.
I guess one possible takeaway from this is that many people engage with these kinds of behaviors, but just not to the extent of it being a major problem for them. And perhaps this is why OCD shows up so much in cinema, in TV shows, because there is something so relatable about this tendency. And I wonder, in a milder form, these kinds of behaviors, they might even be seen in a favorable light, like you're checking carefully, you're being careful, you're being conscientious. And if really that OCD is just a distortion of these characteristics that might otherwise help someone to be more successful or more accomplished in their life.
Yes. Well, OCD people have a lot of important qualities like attention to detail. They're very organized, and those can be very helpful at work or even in school. But the problem becomes the intensity of it because they can't control the thoughts and they can't control the behavior. And this is someone who potentially is not treated yet, right? Someone who hasn't gone into therapy, who's not taking medicine. And we're just talking about the disorder. They're really not able to maintain employment very well. They just keep getting stuck. Maybe they can't even get out of the house, to go to work. So there's a real difference there. Often in our pop culture, we see representations of OCD that maybe capture many of the traits, but I think they minimize the distress that these people go through.
You mentioned shame before as being an emotional component of OCD very commonly, and I imagine there's often a strong anxiety component related to that shame and anxiety in general associated with this. In the scheme of things, people will turn to different maladaptive behaviors, often addictive behaviors, alcohol addiction, drug addiction, as a way of covering up these difficult emotions like anxiety, like shame. What would cause someone to go in the particular direction of OCD?
Well, that's a really good question. There's actually a lot of overlap between somebody who has OCD and somebody who has an addiction problem in terms of compulsions, right? So with a person who has OCD, the compulsions are more ritualistic. Somebody who is addicted to alcohol or drugs or even gambling, it's about these kinds of things, maybe not ritualistic in the same sense. And you also have the inability to not control these things very well, including the urges and the desires that will take you into the compulsive behavior. It's really hard to shut that down. And a lot of the same chemicals are involved. There's decreased serotonin for both people who have addiction as well as people who have OCD, lower dopamine. So serotonin is that calming chemical. So somebody who has an addiction, they're looking for that behavior, whether it's drugs or alcohol, whatever it is, to calm themselves. And they're also probably looking for some joy because their dopamine is low. So dopamine is a joyful chemical. And same with people who have OCD. And in fact, you mentioned before about this being an anxiety disorder. It had been considered an anxiety disorder for years. Just recently, it's now in its own category because it's seen as, anxiety is seen as secondary in OCD. And what makes people anxious is not what's driving the symptoms in the first place, but there's anxiety over the obsessive thoughts. So again, these kinds of thoughts can be very disturbing. People may have ruminative thoughts about wanting to hurt others, wanting to rape others, kill others, really disturbing thoughts for people. And so that creates a lot of anxiety, and that's where the compulsions come in to try to reduce that anxiety.
I hope that you're enjoying Vital Signs. I'm Brendan Fallon. We'll hear more about anxiety in OCD and how trauma can also factor in just a moment. First, let me say to embark with you on this journey to higher states of health is to enact my deepest passion. And seeing that we're all in this together, please be sure to share your experience. If you or someone close to you has OCD, what's the most challenging part of it? Is something helping you or them to keep it under control and support mental health in general? We'd love to hear about it. Find this video at ntd.com/vital signs to leave your comments. Also, to get notice of new Vital Signs videos, follow me at Vital Signs Brendan on Instagram and see Vital Signs on X. It's interesting that the anxiety is a response to these obsessive thoughts, these intrusive thoughts. It bears a contrast to what I've commonly seen, the way this is represented in media a lot, in cinema and things like that. I think of the example of The Aviator, the film. That's a biographical representation, so this is a true story. And this character, Howard Hughes, he had these traits. I was reading that they did a psychological, a psychiatric autopsy after his death, and it came to light that as a child he was isolated. He didn't have any friends. His mother was obsessive about him, protecting him from getting polio. So she kind of fostered this concern about germs. And so I guess, in the film, you see him obsessive about the filmmaking, like the design, his aircraft design and things like that, which obviously paid off on a career level. And then I read that he had a plane crash. It's commonly thought that from that point, this trauma or this experience, that this kind of pushed him really into that behavior where it became totally consuming. Is there a connection between something like a traumatic experience that's one kind of anxiety, and the other type that you're talking about, like as a response to the intrusive thought?
Yeah, trauma can certainly be a trigger for OCD. Now, again, I think you need to look at the brain, the differences in the brain regions to determine why somebody would get OCD versus PTSD. But certainly we see this a lot, whether it's in childhood or adulthood, where a trauma will start triggering these obsessions and then these compulsions to manage the anxiety. Yeah, Howard Hughes, that's a very interesting case, and I think very indicative of what people go through. They can be very intense, right? Because there's a perfectionist quality. Perfectionism is often associated with shame. You have a lot of shame. You have to do things that help you feel you are good, and there's no risk of feeling shame in any way, because shame is one of the hardest emotions to be with. So they can be very determined, very intense. And so they might be able to do well to a certain extent with their work. But you see that in their personal lives, they really suffer. And I think that was true for Howard Hughes. I think his personal life really suffered because of this. It's very hard for the individual to live with, and it's very hard for people to live with that individual.
It's an interesting point, Dr. Russo, that you've made, the way that we may cover up difficult emotions like shame with behaviors like workaholism, which on the surface, it may look like we're trying to achieve some work-orientated goal or task, but there's actually something deeper, painful that's driving that emotion or driving that behavior. It's interesting that they call it workaholism, that it's put in the same scheme as alcoholism and things of these nature as addictions. And I make that connection again between addictive behavior and OCD, particularly when I think about the kind of some of the cinematic depictions I've seen. I think about the film The Machinist, where the character is so overwhelmed by his circumstance, his life is spiraling out of control, he can't process this level of emotion, and you see him reduced to scrubbing the floor, the grouting in between the tiles with a toothbrush, and just in this state of incredible torment. And the whole scene, it looks hellish, and it's like, it smacks of like self-cruelty. I wonder in the same way that an alcoholic drinks to wipe out that emotional pain, or a drug abuser will take drugs to block out that difficult emotion, if in OCD, this kind of state of torment and the emotion associated with that emotional turmoil is not used to block out shame in some way.
Well, that's exactly what they're doing. So I often say to my patients, even in the unhealthiest behavior, there's a healthy drive, right? So the drive here is to try to feel better about yourself. That's great, but the behavior is not healthy. And that happens because the unconscious is in the driver's seat, right? So I think the real purpose of therapy, whatever kind of technique you're using, is to make the unconscious conscious. Otherwise, you're just compelled to act out on these habitual destructive behaviors.
And the unconscious is where these unwanted emotions, like perhaps the trauma or the shame that you don't want to recognize, that's where these emotions lie?
Yes, absolutely. Right. A lot of the contemporary treatments for OCD now, they focus on the illogical thoughts, stopping the compulsions. But in my experience, I think you really need to go back and look at what the underlying issue is. Because just like with Howard Hughes and so many of these people who suffer from OCD, you see problems in their childhood. I was working with one woman in her mid-60s, and her obsession and then compulsion from there was to break people down into parts, and particularly with men walking down the street, she would look at their crotches all the time. And this really disturbed her. But when we talked about her childhood, we understood, okay, there were some issues here that would have led her to this. So what she was doing, again, this healthy drive, she was trying to feel empowered and not oppressed. So she was breaking people down, especially men, into their parts. She was also a very attractive woman, and she knew this. So she could get good attention from men. She felt very comfortable in the bedroom. And so by focusing on a sexual relationship with a man, she could feel empowered. In her history, she was molested by a couple of men when she was very young. And of course, this makes you feel incredibly disempowered and vulnerable, very small. So this was her way of feeling big. If she could just focus on this piece of a relationship with the opposite sex, then she could feel okay. And she would notice that these obsessions and this compulsive behavior would come up when she was feeling particularly vulnerable and small. But by talking about this, she was able to get some distance from this behavior. So I always say to patients, remember, the goal here is distance, not drowning. Because when these people are involved in not just the obsessions, but the compulsions, they're drowning, right? So they can't see what they're doing. They can't step back. That's why it's so important to bring the unconscious into the conscious.
Yeah, that's a very interesting example. And I think obviously not just for people who meet the criteria of this disorder. I think there's so many people are cut off on an emotional level in different ways, therefore limited in how they can experience relationships.
Yeah.
And I'm interested in such an extreme case. Is there a kind of a principle involved to how you open up the communication to reach that unconscious part, to be able to bring that out from someone who's gone for so long shielding that side of themselves?
Right. Yeah, absolutely. I mean, they've gotten to this point because they're really not accepting these thoughts and feelings, which really just feel completely unacceptable. So you have to get them to this place where they feel safe enough to be with these thoughts and feelings. So being truthful with oneself, being honest, that's the very first thing. And so in our sessions, I help them not only recognize what's going on, but I offer a lot of validation and normalization. Of course, you feel this way. And when we're able to look at the history, we can make that connection. This makes so much sense. There would be something wrong if you didn't feel this way and you didn't have these thoughts. So that's the first thing. So they really learn to accept what's going on. That doesn't mean they're imprisoned by them. It's just the opposite. By accepting, and we see this a lot in mindfulness. Mindfulness can be a wonderful tool to combat obsessions and compulsions. When someone is able to recognize something without getting stirred up, without feeling threatened, those thoughts, the behavior, it's going to dissipate. So that's the irony. People think if they get too close, if they accept it, then they're going to be ruled by it. But it's really just the opposite. So there are many practices that create, again, this kind of distance so someone doesn't drown. Mindfulness can be great in this way. Journaling can be really good. Either structured journaling, maybe they're responding to a particular question or one kind of focus, like, what were my obsessions today? And then you make a list of those. And then you look at, okay, what do I think was driving those obsessions? Let me notice, where was I? What was I doing when I had these obsessive thoughts? So they may just write down all of their experiences in response to the questions. It could be more just sort of an open journaling to notice at the end of the day, okay, where was I today? How are the obsessions? How are the compulsions? How am I feeling right now? What do I want to do about this? There's one particular technique where it's maybe a principle from narrative therapy. The idea being that we always create these stories about ourselves. And that can be very useful in therapy, getting that distance when you recognize, oh, I've created this character. Let me look at this character as if it's not quite who they are, at least not in total, right? So they can get that distance and see, okay, this is what I do in these situations. That's not who I want to be. Let me turn that around. And so maybe in journaling, you give the obsession or the compulsion a name. I had a patient years ago in her mid-40s, and she had suffered from obsessive compulsive disorder for decades and really hadn't gotten very good treatment. And so when we looked at the obsessions and the compulsions, we looked at it as a sort of a separate person, and we gave it a name, Harry. That seemed to really connect with her. She liked that. So she would talk about Harry. Harry was really triggered today. He was angry. Well, why was Harry angry? Well, he was responding to this thing. Somebody said this thing about him. Somebody cut him off in traffic. You know, there could be all sorts of things. And so journaling can give someone better self-awareness about what's going on. And again, that gives them that tool to be able to step back, get that distance, and the symptoms dissipate. There's also a technique I use called focusing. And I love this technique. A lot of people don't use this. It's very popular in New York and in Chicago, where it was developed decades ago. It's a mind-body practice that helps you connect to unconscious thoughts, subliminal thoughts, usually by first noticing how your body is reacting to something. So I ask someone to notice their core, throat, chest, and abdomen. And maybe we look at a particular issue, or we start off more generally. How am I doing today? What needs my attention today? And you notice what comes up in this area. So, you know, if you're about to take a test or you're about to do a presentation, you may get butterflies in your stomach. If you're grieving, you might feel your chest is very heavy. So this is information from that unconscious part. And that can be really useful in helping us understand what's going on. And by having a conversation with it, giving it that acceptance, we can then have some kind of a shift, not be ruled by it, and get past it.
It's funny because I also heard about journaling coming through. I spoke to a doctor who specializes in chronic pain, and this is a key method that's used there just to help people become more aware of the sensation in their bodies and connect it with their emotional experience, because I guess many of us are so caught up with our lives and the different pressures of the time that we're disconnecting the pain or the sensation from the emotional experience. The sensation gets stronger and turns into a chronic pain. Getting back to this connection, if you're raising awareness, if you're more aware of your emotional state, that's got to be good for your ability to do relationships. And I see this pattern with some of the examples I've looked at, like again, the Howard Hughes example, this isolated person as a kid, no friends, these compulsions take hold, and then these are more isolating, I imagine, because you're kind of shielding that. It's embarrassing. You don't want people to know that you have this odd behavior, and it's also occupying a good deal of your time, so you can't really do this in a social setting, so you're isolating yourself to do this excessive cleaning and these kinds of things. So I wonder if isolation comes as a part of OCD, does some solution lie in loving relationships and expanding social connection and connection to other people.
Absolutely. That's so important. That's important for all of the mental health disorders. So much of what underlies these conditions is already feeling alone, let alone what the behaviors are doing to increase that isolation. But normally people feel traumatized, or they feel really depressed, or they're really anxious because they feel alone. We can get through almost anything if we feel connected. So certainly increasing social support is very important. But, generally, because for a lot of these people, their behavior is turning people off, and they're very isolated, and they can't just change that. They can't make that go away until they really get healthier. So the first thing is to have a better relationship with yourself, and this is where that self-compassion and acceptance comes in, because so much of what exacerbates these conditions is your response to them. People may hate themselves for having these obsessions and engaging in these compulsions. And like you were suggesting, feeling so embarrassed by these. But if we can take that away, if we can remove the shame, that's a really important piece towards healing. Sometimes what happens is people end up treating themselves as they have been treated. When you look at their history, you see that maybe one of their parents, maybe both of their parents, was very abusive and critical. And so anytime they might have expressed themselves or made a mistake, they get a very harsh response to that, whether it's a verbal abuse or physical abuse. So then they learn to treat themselves the same way, thinking, if I am just tough enough on myself, then I'll be better. And then I'll finally be that child that I need to be to get my parents to love me. I'll be a lovable, good object. I see this all the time. And that's why it's so important to unravel the old stuff.
And in terms of what you were saying about the potential for OCD behavior to be a turnoff in a social setting, it strikes me as a kind of double-edged sword, where that social exposure could offer hope on one end of ameliorating the isolation, but at the same time have the potential to cause more emotional problems with the rejection that might follow from someone's off-putting behavior. Drawing that connection again to addiction and looking at the example of alcoholics, where the Alcoholics Anonymous program has been so effective, where you have people somewhat recovered in their addiction and they're able to help people who are steeped in it. I wonder if that same setup, if that could be beneficial for people dealing with OCD, where someone has made some progress in their recovery, they're able to help people who are really steeped in their OCD.
Oh, absolutely, yes. And, this can be a trait, certainly for people with OCD. They can have more empathy than other people because they understand what it's like to suffer like this. So, yes, when they get more healthy, when they've developed a better relationship with themselves, there's less shame, they should be able to get out there, and helping others is really great. That's healing for that individual. This is true for depression, any of the mental health disorders. When you feel you have something to offer, that's so important. And of course, the social connection. But, this idea of having meaning and purpose is also very, very important. And I think this goes back to that umbrella of connection. So whether it's social connection, a better connection with yourself, you need to have this sense of purpose. I have something to offer, and here is something that's meaningful to me, that connects me to the world. And here's how I can engage with the world. That's so important. Viktor Frankl, he was a psychiatrist. During World War II, he was in the camps. And he wrote a book about this, Man's Search for Meaning, where he talked about some people went through the camps and were completely destroyed. And then others went through the camps, and there was a sense of resilience. And the difference was they were able to find meaning and purpose. So something else I often say to patients, life is perception. Two people can go through the same thing, but come out of it so differently. Why? Because of perception. That's the most important thing. We all have very little control when it comes to the outside world. But what we can change is what's inside.
I really have enjoyed this conversation, Dr. Russo, because I think we've really gone deep on the deeper reasons why someone may have this kind of problem. I want to ask you about a bit further about that in terms of purpose and meaning in a second. But first, interim of kind of coming to an understanding of what our deeper purpose is. When people are struggling with this kind of situation, do you have kind of a toolkit that you offer people for what they can do, or I guess even in generally dealing with anxiety, how they can get by in the moment to get on and do what they have to do, or make it to the next pit stop, so to speak?
Yep. Well, I think it comes back to this acceptance. So if they're able to notice and say, it's okay, maybe those very words, it's okay, that really helps to reduce the stress and the compulsive behavior. Because again, the compulsion is designed to reduce the anxiety of the obsessions. But if you take away that anxiety, if it's okay that they have that thought, maybe they wouldn't prefer to have it, but if it can be okay, that takes away so much. So that's really good in the moment. And then later, maybe at the end of the day, they do their journaling, they do some meditation, and they're able to just notice, okay, I have these feelings. They're not overpowering me. I'm the one in control. And, this is also something else important about mindfulness. It reminds us that life is very fleeting, including our feelings, our thoughts. There have been many studies to show us that we can have 6,000 thoughts a day, right? A thought can be very quick. It can be very unconscious. It comes and goes. So that's the whole idea. Things can come and go. It all depends on how we react to what's going on inside. If we're going to get anxious and full of shame, well, we're a slave to it, and we've made it huge and formidable. But if we can step back from that, that changes everything.
How have you guided someone to use mindfulness on a basic level, like, say, someone who's come in maybe for a first treatment and their first session with you, and they're feeling a bit overwhelmed by their circumstance? Is there something like a basic strategy that you suggest to get to kind of ground them in the interim?
Well, because they're so caught up in their obsessions and fearing where this is going to take them, it's a little bit of a distraction I might use with mindfulness. So I ask them to just notice, what do you see in the room? What does the sofa feel like? The sofa they're sitting on. What does it feel like to have your feet on the floor? What about breathing? How does that feel for you? Can you make your breathing a little bit more open? Wow, you can control that. Right? But just by noticing that, what's the temperature in the room? So I get them to just notice a lot of things that take them out of that obsessive loop.
Shortly, we'll talk more about the profound role of life purpose in shoring up mental health. We'll also offer guidance on specific resources to help manage OCD. First, though, here's a glimpse of my interview with leading weight loss expert Dr. Jason Fung on why Americans are more overweight than 50 years ago, and what can be done about it.
Think about the 70s. You look at those old pictures in the 70s and nobody's obese. Well, they're not eating all the time. If you know that your body, when you're not eating, is going to be taking calories and burning them, why would it not be important how long you spend burning calories? In fact, people thought the opposite. People thought, oh, you should eat all the time. But then when I started thinking about it and reading the actual studies, it's like, well, how is that going to work exactly?
If you're fasting, then your body isn't going to be detecting any protein and your stomach isn't going to be swelling. So wouldn't this cause starvation problems or cause you to want to eat more? Afterward, find the link to that video at the top of the comments and also in this video's description below. And if you're finding this video helpful, please be sure to share it with family and friends by clicking the share arrow below. I was thinking about this Marine Corps vet that I've interviewed, talking about his experience in the Battle of Fallujah at the Second Iraq War. Coming home from that, there's the traumatic experience that many of these veterans have been through, being shot at and explosions going off. But he was saying that what's often missed and what really takes a toll on them is they've come out of this intensity of purpose, of meaning, where it's life and death, and then they're put in this suburban setting where the volume is just incredibly turned down, and they've lost that immediacy and urgency of purpose. He became a writer, so he's a very successful writer, and that's been a channel for him to process things, and a self-affirming thing as well. So I guess you can't really give someone a purpose. You can't tell someone what their meaning is, but you can inspire them in that direction. And I wonder, what are your thoughts on how you might inspire someone in that way?
You have to find out what they enjoy, what helps them to feel good and strong and connected. I had a patient, a 25-year-old male, who during the pandemic, he started developing OCD symptoms. So it's a little bit like what you were saying, not that he came out of such an intense environment, but his environment, like so many of our environments, had a lot more stimulation. He went into work, he went to the gym, he did all sorts of activities, seeing people, and then all that ended. He was working from home, much more isolated, and he started ruminating. And he had this pattern where he would start worrying about his work performance, and he would have to say to himself, okay, 3 times. And then I might stop temporarily, but we'd have to keep doing this because he just didn't have enough going on. Freud talked about all of us need to have some kind of a sublimation. We need to put our anxiety somewhere because we all have some sort of anxiety and energy, and it needs to be directed somewhere. So work is often a good form of sublimation. You put the energy into work. And so we found out, okay, well, what are the areas previously that were important to you? Activities, things that you could do that helped you feel that sense of meaning and purpose. Going to the gym was huge for him. So that was one thing. He wasn't seeing his friends as much. So we talked about getting together. Maybe you don't go out to a restaurant, but you go over to somebody's house. They can come over to your house. He also developed a fear of germs and contamination. I think like a lot of people ended up doing during the pandemic. So we addressed this too. And we looked at the pros and cons. Okay, so you get sick, but this is no way to live your life, right? You're feeling anxious and depressed because you're not connected to people. And that's so important. So really just getting a sense of what the person enjoys and what the person feels is important for them.
Yeah, I think there's a potential to really overthink our purpose when, as you say, like just having that connection, the basic social interaction, you're fulfilling a purpose because you're contributing to other people's lives. There's that dynamic that happens when people are together, so something is being created in that space.
Yeah.
Dr. Russo, it's been fantastic to speak to you and to get this really deeper perspective on what's causing OCD and ways that people can find a way beyond that. Thank you for coming on.
Thank you so much for having me. This was great.
So OCD is often marked by overactivity in particular parts of the brain, such as those involved in error detection or habit formation. This may explain the OCD sufferer's often strong sense of shame from a perception of having done something wrong, and also the tendency to develop habitual, ritualistic behavior patterns. The shame that stems from intrusive thoughts, say of wanting to hurt someone, can be a driver of compulsive behaviors, which may provide fleeting relief from unwanted thoughts and emotions, but can become major disruptions in themselves. So we've looked at methods like focusing and mindfulness, which can help turn down the volume on those intrusive thoughts in a healthier way. You can check the description below for the link to a specific guided visualization that Dr. Russo uses to help people process difficult thoughts and emotions through gradual exposure.
I want you to create a scene that's very, very peaceful, a scene in nature. It could be on the beach, it could be on a grassy hill.
Also, there is a link to nutritional guidance for those with OCD, targeting some of the nutritional deficiencies that may accompany the disorder. And I've included a link to OCD support groups where people can share their experience of managing and recovering from OCD to help and inspire others. These particular groups are run by the International OCD Foundation. Up next, why are Americans more overweight than 50 years ago? Weight loss expert Dr. Jason Fung reveals how often we eat can be as important as what we eat in losing weight. The link to that is in the comments and description below. And remember, you can subscribe to stay abreast of our Vital Signs Health Insights by clicking that big red button below. It's been great to be with you. I'm Brendan Fallon, and this is Vital Signs.